Dr. Bill Adams here. This is No Spin Live, everybody's favorite show. This was actually kind of like a blog post basically by a plastic surgeon, but we found it interesting because, kind of addressed the whole thing of plastic surgery chains, which there's some out, they've had Lifestyle Lift and some other ones that are out there, liposuction clinics. So there's some, I thought, relatively interesting insights, and apparently this person actually had worked at one of those clinics. But Ned, I'm going to start with you. What was your take?
Oh, I thought it was great. The perspective is unique, meaning that most of us haven't done all of those things that she has done. One, obviously, been a plastic surgeon in private practice, worked in a chain plastic surgery center, and then even was a patient in a chain plastic surgery center. She gave some pretty good advice in the sense of just looking for red flags, things that we should all be, that all patients should be aware of and should be sort of looking out for.
Yeah. Theo, what do you think?
Like I always say, discount plastic surgery is like discount sushi. It may work out. If it doesn't, you got a big problem. I thought this article really kind of gave a unique perspective. Sometimes people are coming in and they're like, well, this guy's charging this, and you got to ask yourself, well, why is there a discount? And something this important, do you really want to gamble on it? I thought it was a good article, and I commend it for being able to shed that kind of light, because I think patients oftentimes don't see both sides of the coin. So good article.
I worked at a place like that when I first went into practice for about a year and a half. So I have that perspective about that versus private practice, and I agree with the article wholeheartedly. At these clinics, most of the time, you're either going to find young plastic surgeons who are just out there looking for some cases. And it was a lot of cases early on that I got a lot of experience. But you're also going to find some older guys who are just not cutting it in private practice and going to this. So you're not really finding the best of the best, because Bill and I have both been in practice like 20 years. And look, just as an example, my breast dog today is not a breast dog I did 20 years ago. I mean, I'm down to thinking about millimeters versus back then it was a whole different world.